So let's go ahead and move on to the second packet here, and starting with objective 2. Now this objective is really going to apply for the next couple of packets. And what we're going to do is really look at each branch of the vasculature and talk about the ways that the structures differ, the way that the function differs, and just how they play a role in what we've been talking about so far, which is blood moving through our vasculature. And so each branch looks completely differently. The arteries look different from the arterioles, from the capillaries, from the venules, from the veins, and even the lymphatics, which we'll talk about at the end. And this is where we see, again, that form follows function. The way that something looks dictates something unique about its function. So those unique structural properties lend themselves to unique functional properties as well. And so we're going to start here. Now, what I would encourage you to do as far as really grasping the next couple of packets and grasping the differences between these branches of the vasculature is drawing a large kind of table and putting all of these as headings. So you've got arteries, arterioles, your capillaries, venules, veins, and really start to differentiate the different structures, right? What has more smooth muscle, what has more elasticity, what has more resistance, and really start to delineate those functional properties in a table format as we go along, so that by the time we, at the end of this, you've got, a clear table as a study tool to kind of help you keep all of these straight and be able to appreciate some of the differences. So let's start off by talking about kind of an overview of our vasculature. So we've got arteries that are mainly carrying blood away from the heart. And again, we want to think about an artery in this way. This functional qualification that it's carrying blood away from the heart and not so much that it's carrying oxygenated blood. Remember, we talked about the fact that we do have arteries that carry deoxygenated blood, like the pulmonary arteries. So a truer description of an artery is a vessel that carries blood away from the heart. Then we've got the microcirculation, which comprises arterioles, slightly smaller arteries, more muscular. We'll talk about the structure in a little bit. Then we've got capillaries. This is the site of exchange, right? We've got nutrients being absorbed. We've got waste products, byproducts being released or secreted. And then we've got venules, which are our smaller branches of the veins. So that's going to be the microcirculation. And then we get into veins. And here again, the truer description of a vein is a vessel that returns back to the heart. Now, which chamber do veins return to? Can anyone recall which chambers do veins return to and which chambers do arteries leave?
The veins return to the vena cava?
So they are in the vena cava, so that's kind of where they culminate, at the vena cava, but then that goes into what type of chamber? Is that a ventricle or is that an atria?
The atria.
Excellent. So our veins are going to return to the atria always, whether it's the pulmonary veins or the systemic veins like the inferior vena cava. And then arteries are always leaving the ventricles, right? The pulmonary arteries leaving the right ventricle. The aorta, which is the largest artery, is also leaving the left ventricle. So that's another important description of our arteries and veins. Arteries always leaving a ventricle, veins always returning to an atria. Okay. So let's kind of look at some of the structures here in the schematic. And I'm just going to point out some of the main differences here. But again, we're going to go through these individually. Arteries are much thicker in their wall. They have less space for blood to flow because of that thick, smooth muscle that they've got underneath the epithelial layer here. So we've got a thicker, smooth muscle in arteries and a thinner, smooth muscle in veins. And then another kind of overarching difference that we see throughout the vasculature is that capillaries are really small, right? This is indicating to us that capillaries are going to be the site of exchange. So the cells here are, the walls here are one cell layer thick, and that's going to be an easy barrier for exchange that we'll talk about later on. So some main overarching kind of unique features: arteries, thicker wall, smaller lumen; veins, thinner wall, larger lumen; and then capillaries are one cell layer thick, very, very small vessels. Let's continue on here and talk about the structure of these vessels. So we've got the endothelial cells that line the inner layer of our blood vessels, all of our blood vessels. And this is the only layer that we see in capillaries, whereas in our other branches of the vasculature, we also have muscle and so on. And then this wall is usually comprised of smooth muscle, fibrous connective tissue, which is going to be collagen. That's going to give some tensile strength to that vessel. And then elastic connective tissue, that's going to be elastin. And that's going to give some stretchability or giveability or malleability to the vessels as well. So we want our vessels to be strong and tough and tensile in terms of resisting the pressure that's being exerted on the walls, but we also want them to have some elasticity, some giveability, and be able to stretch to accommodate different volumes. And we'll talk about how some branches of the vasculature have more smooth muscle, which I kind of indicated earlier. Some branches of the vasculature have more elastin, such as the larger arteries. So these are some of the structures that we see common to all vessels, but they're going to be in different proportions for different branches of the vasculature. Let's start off with our arteries. So arteries, we said, are larger in their diameter. And this, we want to compare this to all of the arterial branches. So they're not as large in the diameter in terms of the lumen, but they're large in the overall width of the vessel, right? We really want to make that distinction. We said that they have a smaller lumen, but because they've got so much muscle in the wall, they wind up being a larger vessel altogether. They also have less resistance, very, very little resistance. Does anyone want to try to predict why there's less resistance in arteries? So why do arteries have less resistance? And it's kind of a simplistic answer, but feel free to think.
Is it because of their large diameter?
Not so much, but that's a good guess.
So they can reach like all the different parts of the body?
Yeah, excellent, exactly. We don't need, it's not ideal to have that much resistance as soon as we leave the heart, right? Remember, the heart is what's creating the driving force, the pressure that's moving blood through the vasculature. And so the arteries are kind of the first vessels out of the gate. And so we don't see a lot of resistance here because we need this blood to go a much longer distance. And we'll talk about the next branch of the vasculature where we do see more resistance. But essentially, the arteries have very little resistance so that this blood can move throughout the remainder of the vasculature. The walls and arteries are going to be elastic and fibrous, more elasticity than we see in any other branch of the vasculature. And this is to sustain the high pressures that we see coming from the heart once again. When we look at our muscular arteries, which are slightly smaller than our larger elastic arteries, they're going to have a smaller diameter overall. They're going to have less elastin than our larger arteries. When I talk about large arteries, I want to think about the aorta, which has lots of elastic fibers to really give it that stretchability. And we'll talk about the importance of that elastic nature in a bit. But our muscular arteries don't have as much elastin. They don't have as much give, but they do have a lot of smooth muscle, and they do heavily regulate their radius because of the relaxation and the constriction of that smooth muscle. So our larger arteries have lots of elastic fibers. Our smaller kind of muscular arteries have more smooth muscle in the lining, but less elastic fibers, and they're smaller than the larger arteries. Okay, let's talk about the pressure reservoir. So we can refer to our arteries as being a pressure reservoir. And later on, you're going to hear me refer to the veins as being a volume reservoir. So two really important functional differences between arteries and veins. Arteries have this ability to store pressure. We talked about this last semester as we looked at the pressure in the aorta, which is the mean arterial pressure throughout the cardiac cycle. And so because we have flow moving through the artery during systole, and then during diastole, we actually don't have blood flowing from the ventricle, we need to be able to store that pressure in the wall of this artery and be able to release that pressure during diastole when we no longer see flow in order to keep flow to our systemic organs constant. And so because of the thick elastic wall that we see in these arteries, particularly the aorta, we see that ability to store pressure during systole and then release that pressure via the elastic recoil that we see during diastole. We can also describe our large elastic arteries as being low in compliance. And this is a somewhat confusing topic, but the simplest way that I can describe elasticity and compliance is to think about maybe a pair of sweatpants or a headband. And if you've got a brand new pair of sweatpants or a brand new headband or a brand new hair tie or elastic band, it's going to be high in elasticity, but low in compliance. Okay. If you've got a really worn out pair of sweatpants or a worn out headband or a worn out elastic band, it's going to be high in compliance, but low in elasticity. And so elasticity and compliance are opposite ends of the spectrum. And if you think about it, when something is elastic, it wants to return to its natural shape. If I stretch a brand new elastic band out, it's immediately going to kind of recoil on itself, and that is going to be low in compliance. On the other end of the spectrum, when something is high in compliance and you stretch it, it doesn't want to return to its original shape, right? It's going to be more obedient. It's going to be more flexible or malleable, and it's going to keep the shape that you put it in because it's more compliant and less elastic. And so really important to understand what elasticity and compliance are, but also to understand that they're actually opposite ends of the spectrum. If something is high in elasticity, it's going to be low in compliance and vice versa. And so we see in our large elastic arteries like the aorta, they are able to expand and store that pressure. And because they're elastic and low in compliance, they're able to recoil really quickly back to their natural shape, which they want to do naturally. And then that is going to allow blood to be flowing, continuously throughout all phases of the cardiac cycle.
Can you just quickly touch on compliance? Like what exactly is that again?
Yep, sure. So one word that I like to use to describe compliance is also obedience. If something is obedient, if you put it to one shape, it's going to stay there. Whereas if it's not obedient, if it's not compliant, if I stretch it, it's not going to stay there. It's going to want to go back to its original shape. And so we can think again about maybe an elastic band. If you stretch a brand new elastic band out, it's going to really want to get back to its original shape. And so we're going to say it's high in elasticity, but low in compliance. It's not obedient. But if you've got a really worn out elastic band and you stretch it out, it's not going to be eager to get back into its original shape. And so we're going to say that it's high in compliance, it's pretty obedient, but it is low in elasticity, does not recoil to its natural shape easily. And so compliance can be described as a measure of how the pressure of a vessel will change with the volume. If we have a low compliant vessel, such as we see in arteries, these vessels really want to get back to their original shape. And so what we'll see is that a small increase in volume will cause a large increase in pressure. And just to expound on that a little bit more, if I put a little bit of blood into my aorta, it's going to generate a lot of pressure because of that elasticity of the wall of the aorta. Whereas if I'm looking at my veins are going to be low in elasticity, but really high in compliance. Therefore, if I stretch my veins, they're not going to be eager to get back to the original shape. And so they're not going to generate as much pressure on, from the walls onto the blood. And so we can say that veins have a way to accommodate more volume without generating as much pressure. In other words, a large increase in volume is going to be required to create any pressure changes in a vein. Okay. And I'll kind of pause here. This is usually something that's quite difficult to kind of grasp. If you've got specific questions, feel free to let me know. All right, I don't see any questions coming up, but I will just go ahead and explain this one more time and then we'll keep going. So essentially we've got a low compliant vessel, which we describe to be our arteries, mainly our large elastic arteries. They're high in elasticity, lots of elastic fibers. They really want to get back and maintain their original shape. And because of that high elasticity, low compliance, if I put a little bit of blood in my aorta, I'm going to generate a lot of pressure. Okay, small increases in blood volume generate large increases in pressure in our elastic arteries because they're low in compliance. On the other end of the spectrum, I can accommodate a lot more volume in my veins. They're not as elastic. They're much more compliant. They're much more obedient. And so if I put a large amount of volume if I put a small amount of volume in my veins, I'm not going to generate much pressure. But I'm going to have to put a larger amount of volume in my veins in order to generate pressure differences, okay? So arteries, low compliance, high elasticity, small changes in pressure generate small changes in volume generate large pressure differences, whereas our veins are going to be the opposite. They're highly compliant, highly obedient is what I like to describe it as, low in elasticity, and so it's going to take a large amount of volume to generate large pressure differences.